Hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, December 2nd. That means this is the first of 2 monthly scheduled support group meetings for December 2018 for anybody struggling with interstitial cystitis, bladder pain, pelvic floor dysfunction, irritable bowel, vulvodynia, anything related to pelvic pain, we're going to cover today. All right, my friends. And so I have a lot of things we're going to talk about today. Hello, Cheryl. It's very, very nice to see you. I have got a ton of stuff to show you guys today, but we're just going to take a minute, let some people come in. I want to explain a little bit about why I do these support group meetings. Hello, Deborah from Lodi. Very, very nice to see you. You're pretty close to me. I'm over in Sonoma County. And it's a gorgeous fall day here in California. And I'm very happy to say that unlike a week ago, we have no smoke in sight. After 6 months of a terrible fire season, it has been brutal. Hello, Dale. Very nice to see you. Hi, Nicole. Hi, Sherry. Hi, Tabitha. So as always, you're welcome to ask any questions that you have. Hello, Heidi from Lakeland, Florida. It's always nice to meet another Heidi because I am a Heidi also. My middle name is Heidi, Jill Heidi Osborne. So I have a ton of stuff that I'm going to show you guys today. Let me just get these close while I'm doing it. Oh, yeah. Hold on. I got to dump them all out. I have a whole bag here of icy stuff for my warehouse. Woo, look at all this stuff. Look at all these goodies. We'll be talking about these in a minute. More good stuff. So the reason why I do these meetings is I want you to be so strong, so powerful, so informed, so educated that no one can mess with you. You would be stunned if you could hear the IC Network phones every week. Because the stories that I get from patients are nothing short of astonishing. Doctors who are bullies, doctors who tell patients there's no hope, doctors who say that there's no treatment, family members who are bullies, family members who show no sympathy, friends who show no sympathy. One of the most amazing stories one of the most amazing patients that I ever worked with was the daughter of a physician. And she was somewhere in the Carolinas. She had bleeding Hunner's lesions, and she was in the hospital peeing blood. And her father doctor did not believe that IC was real, and he disowned her, abandoned her in the hospital as she was bleeding. It's astonishing. Of course, that was 15 years ago. Look, more stuff. We've learned a lot about IC since then. We know about IC subtypes. We know that it's real. We know that the U.S. government has put at least $100 million into IC research. Believe me, they would not do that if this were not a real condition. And so my goal with these support groups meetings is to make you so strong and so powerful that no one can mess with you again. I don't want that to ever happen again. So normally the way I do these meetings is I spend a little bit of time doing a little bit of 15, 20-minute education. And then we're going to do some giveaways. And I've got a lot of giveaways today. You know, hey, man, it's the holiday season. Let's have some fun, right? Let's have some fun. I don't know about you, but I love the holidays, but I love the first couple weeks of the holidays. The first 2 to 3 weeks of December to me are glorious because people have their Christmas lights up. It's peaceful. It is sweet. It is kind. And then when the actual week of Christmas gets there, that's when it starts getting a little stressful. And that's when I think for many IC patients, that's when we really start to struggle, not only because of expectations of family members and our own expectations. We want to be able to have the same traditions that we had for years with IC, like going to church at midnight or going and having a snowball fight or driving up to the snow or whatever. And when you've got IC and if you're in an IC flare, it's pretty hard to do stuff like that. And so I want you to be this year as gentle as you can be to yourself. No shame, no blame. If you're in a flare, we need to respect the fact that right now your body is struggling. And I want you to be gentle, calming, and soothing to your body. If you don't feel like you're going to be able to make a long trip during the holidays, then invite everybody to your house. If you don't feel that you can do a traditional, one of the old family traditions, then make your own tradition. Make a new tradition. Some patients, for example, have always gone to grandma's house for Christmas. I know, and I've talked about this in past support group meetings, there are times when you just really have to say no. It's like, I don't feel good today. This is not a good day for me to travel. And giving yourself permission to stay home sometimes and stay with your family home is okay. No expectations here. This is about celebrating it every day. It's about taking those small, sweet moments and letting the joy of the season fill your spirit, right? And so that's what I wish for you today. I wish that you will have many small, sweet, happy moments, whether it's looking at Christmas lights, whether it's doing something kind for somebody else, whether it is sending Christmas cards to your IC friends. That's what I wish for you, is small, sweet, kind moments for the holiday season. All right, Lisa, Lisa, I'll take a couple questions, but then I want to talk about something. Lisa, what to do for frequency and pressure? Doctor gave me Myrbetrix, but OAB meds caused me retention. Okay, so Lisa, it comes right back down to that critical question. When is your pain the worst, before you pee or after you're done peeing? If your pain is worse as your bladder fills with urine and you feel better after you empty your bladder, that tells me that this is coming from your bladder wall. If your pain is worse, not before you pee, but after you're done peeing, that tells me that this is coming from your pelvic floor. So you're on YouTube. Answer that question. When do you feel the worst? Before you pee or after you're done peeing? Nancy on YouTube says she's been 2 months pain-free. Yeah, baby. Yeah. That's what we love to hear. You got to remember, people, that for every person online having a bad day, there are thousands having good days, right? Support groups like this meeting, or a support forum on our website or a group on Facebook, they're always going to be biased towards patients who are suffering. And you have to really give yourself a reality check here, because for every patient online having a bad day, there are thousands having good days. There are thousands having good days. And so you got to keep that in perspective, that sometimes the worst place for you to go over and over and over again is into a support group, because you're starting to think that everybody's doing bad, when in fact, most patients are actually doing pretty well. All right. So Lisa says her pain is worse as her bladder fills with urine. Okay. So Lisa, that tells me that you're either IC subtype 1, Hunner's lesions, IC subtype 2, bladder wall driven, or maybe IC subtype 5, central sensitization. So let's look at what irritates the bladder, what causes that bladder wall. Here, and Heidi on YouTube says her pain is after she pees. So Heidi, your pain after you pee is your pelvic floor. So let's get back to Lisa for a moment. And Ryan, hold that question, because that's a very, very good question. All right. Okay. So Lisa, pain as your bladder fills with urine is pointing to Hunner's lesions, bladder wall driven, or central sensitization. The odds are bladder wall driven, but can you please tell me, do you have Hunner's lesions or do you have just typical bladder wall? Lisa's on YouTube. We're going to help her with a flare right now. So Lisa, has anybody looked in your bladder and told you that you have Hunner's lesions, or is it just typical bladder wall driven? Do you know? And while she's answering that question, people, please feel free to ask your questions. Just know that if I miss your question, it just means that it's scrolling through very, very quickly, and you feel free to ask it again. Hello, Betty from Frosty, Minnesota. Hello, Julianne from Germany. Very nice to meet you, Julianne. I just had a chance to meet yet again the German ICA support group leaders a couple of months ago at the American Urology Association. And if you're not familiar with the German ICA, I would encourage you to Google that, because you do have a pretty good IC support group over there in Germany. All right, Lisa. All right. So Lisa has not answered that question. We don't know if she has Hunner's lesions, or we don't know if it's if anybody's looked in her bladder. So let's just assume for a moment that she's got Hunner's lesions. Hunner's lesions are big bloody wounds in the bladder. And because they are big open wounds, urine in those wounds is going to hurt, right? And so patients with Hunner's lesions are going to struggle until those lesions are treated correctly. A lesion generally is treated with a laser therapy or fulguration, some sort of heat to seal it. Because think about it, when you get a bloody nose, what do? A bloody nose that won't stop bleeding, they cauterize it. If you've got a wound in your bladder that won't stop bleeding, they cauterize it. And so they will either laser it, fulgurate it, or they will inject it with a steroid. Okay, so if you had Hunner's lesions, number one, we got to get those lesions treated correctly. And also, let me just say that if you're one of those patients where your symptoms just continue to worsen, and or you have blood in your urine on occasion, you always want to suspect Hunner's lesions, and we need to get someone to look in your bladder to make sure that if you do, those are treated correctly. Okay. When you have Hunner's lesions and or bladder wall injury, diet is everything. Because if you're pouring acid on a wound, it's your fault, right? And so if you had a wound on your hand and you poured coffee on it every single day, a big bloody open wound on your hand, you poured coffee on it or soda on it, what's going to happen to that wound? It's going to get worse, absolutely, by far. And so a better way to think about it is wound care. If you had a wound on your hand, how do you care for that wound? Well, you rinse it off with water and you put a Band-Aid on it. If you have a wound in your bladder, you rinse it off with water, and if necessary, we can try to use a chemical coating, a chemical Band-Aid like Cysto Protect, Cysto Renew, or Elmeron, right? So Lisa, I want you to think of your bladder as injured right now. Your bladder is traumatized. So the only thing you should be drinking is water, and the other thing I would recommend that you drink is a chamomile herbal tea. Why? Because chamomile is very calming and soothing to the bladder. All right. So during the short term, that's what you've got to do. You can also try something like, where is it? Hold on. Where is it? Ah, here it is. All right. The second thing you can do, let's just assume that this flare is because you ate something that you shouldn't have eaten. So the second thing that you can do is drink water. Let's dilute your urine, dilute the irritants in your urine. If necessary, you can alkalinize your urine. How do you do that? You can take a Tums. You could do a 1/4 teaspoon of baking soda in a glass of water. Don't do that every day, just every now and then. That's one of the old ways that people can alkalinize their urine if they've eaten or drunk something that has pissed their bladder off. Or you can use something like Pre-Leaf. Okay. I would want you to use heat. Let's get some heat on your belly, because anytime you're in pain, your muscles are going to get tight. And the tighter they get, the worse the pain, because they're cutting off blood flow to the bladder. So let's get some heat on there. If you need to use pain medicine, if you have pain medication, use that pain medicine. But be proactive. Don't wait until you're bawling your eyes out to use any pain medicine. You want to catch it early. I'll tell you what I do. This is what I do when I have a flare. And you guys, you need to know that I had my first symptoms of IC when I was 12 years old. I'm 58 now, right? I was diagnosed with IC when I was 33. And I will tell you, the bladder pain that I went through the first couple of years was staggeringly bad. staggeringly bad. And I am pain-free today most of the time. But I learned something early on that was really helpful for me. And that is, God, how do I, I always do this in lectures. It's like, how do I want to say this? So you need to know that I have a degree in drug development, pharmacology, right? And ironically, in that first year when I was bawling my eyes out every single day and I would drive to work and I would literally cry out if I hit a speed bump, I never asked for pain medicine, ever. Didn't even dawn on me to ask for pain medicine. And finally, I ended up at the emergency room 2 days in a row, bawling my eyes out, and they gave me a shot. And it was stunning because it turned everything off. It turned my pain off. It turned my frequency off. It turned my urgency off. And that was mind-blowing to me that you could actually turn it off. Ironic. Hello, drug development degree. Didn't even dawn on me. How silly is that? And so they finally gave me a prescription of, back then, Vicodin, which was a codeine, Tylenol, acetaminophen thing. And so they sent me home, and obviously I was just in deep distress. And I took one pill, and I got very sick from it. I got very nauseous and kind of dizzy. Now, most people would think that that's an allergic reaction, but that's not an allergic reaction. An allergic reaction is when you take something and your throat swells and you break out in hives, or you have trouble swallowing, or you have trouble breathing. What I had instead was nausea. And so that was the one gift that my drug degree gave me, is sometimes less is more. Instead of finding the highest effective dose, sometimes you have to find your lowest effective dose. So what I did the next time is I cut it in half. And this was a pill I could cut in half, right? It had a score down the middle. There are some pills that are time release that you cannot cut in half. If you do, you could overdose. So you always have to look at the pill, see if there's a score, talk with your pharmacist, make sure it's okay, or your doctor. So anyway, I took half of a pill. And what was amazing to me is that it turned the pain off, but I also didn't have the dizziness, right? And then so I did that every now and then. And then I took a quarter of a pill. And you know what? The same exact thing happened. The same exact thing happened. It would turn my pain off, but I wouldn't have the side effects. And I could work all day, even with just a little tiny bit of medicine. So I learned that 22 years ago. So then I developed what I considered my pain protocol. And that is, whenever I could feel the pain starting, and this is not little pain. This is like the big whomp and kick your butt type of pain. If I felt that pain for 30 minutes, what I did is I stopped what I was doing, grabbed a big heating pad, threw it on my belly, and sat in a recliner for 30 minutes to see if I could just let the heat ease it away. If 30 minutes later I still had pain, I gave myself permission to take 1/4 of a Vicodin, 1/4, and then I waited an hour. And an hour later, I would reassess and go, all right, do I need to take more? And if I did, I would take another 1/4. Now remember, I'd only had pain for 30 minutes. So I'm catching this pain really, really, really early, right? And it's like, pain is like fighting a fire. If you have a little fire in your wastebasket, seriously, 1 glass of water is going to put that pain out. If you wait until you're bawling your eyes out and your entire house is in flames or your whole body is in flames, it's going to take a lot of water to turn it off. So one of the secrets to pain care is to catch it as early as you can, with as little as you can, and not let this pain and this flare get out of control. Okay. So 30 minutes in pain, gave myself permission to take 1/4 of Vicodin, waited an hour. I will tell you that 95% of the time, that 1/4 of a Vicodin turned that flare off. I was done. I was over. Now, remember, I'm IC subtype 5 central sensitization, so that makes sense because it's all about, for me, nerves that are very sensitive, right? So, however, there were times when at that half-hour mark, I needed more. So then I gave myself permission to take the next quarter. And I'd wait another hour or 2 hours. And then I'd go that way. And you know what? Seriously, I could make a prescription for Vicodin last 2 years doing it that way. Now, of course, granted, I was already following the diet right there. I was being really, really careful with my bladder. I wasn't doing anything bad. I was protecting myself. I realized that I was in a situation where I was trying to help a wound heal. And that's really what got me through the first 5 years of my diagnosis. Was as soon as I felt pain, I acted early. I acted as early as I could. And that's what you've got to think about when you're having a flare. Don't force yourself to keep running. Don't run through the flare. Don't run through the pain. If you can, stop what you're doing, sit down, grab a heating pad. Let's see if we can just get things calmed down. At the same time, you can also use something like Desert Harvest Aloe, right? Desert Harvest Aloe, which has a nice soothing effect on the bladder. That might be useful for some patients. Or Cystoprotect, or Cystorenew. And these are for bladder wall flares. Now, there comes a time where if this flare simply will not stop, you got to call the doctor and say, hey, I need a rescue. I need a rescue instill. And that's like hitting the nerves with a big, strong numbing effect. And that's why it's called a rescue installation, because it can rescue you out of a flare. That's why we don't do a lot of those old bladder installations. We don't do silver nitrate. We don't do chlorpactin. We don't do bladder strippers. And we're barely doing Rimso, DMSO, because all of those generally hurt. Instead, what we're doing is things that are calming and soothing and healing. And that is, in fact, why a rescue installation is a really good proactive way of breaking yourself out of a flare. And so the protocol for a rescue with a flare is, if your doctor will do it, you can do 3 a week for 2 weeks and then 1 a week for 4 weeks. That's a published protocol for it. Or you can actually have your doctor teach you how to do it and let you do it at home. And that would be another good way of breaking out of that flare, Lisa. Maybe is to try that. So you guys, for those of you who just came, we were helping Lisa with the bladder wall flare. So let me just look at what she's saying here. So Lisa says she just has frequency urgency. And so that is because okay, so here's the side view of the bladder, right? So you've got a mucosal barrier. You've got about 4 to 5 cells of urothelial cells. These is basically the skin of the bladder. And then underneath that, you have blood vessels. That's these holes. And then you've got nerves. The bladder has 2 functional nerves groups. It's got the alpha afferent nerves, which control frequency urgency. And it's got the C fiber, which controls pain. Now, the alpha afferent nerve is a nerve that is very easy to turn on. This is a nerve that your body uses every day to tell you when you need to pee. It is deliberately meant to be easy to turn on. Thus, the first symptom, anybody with any type of bladder issue, whether it is a UTI or whether it is a bladder injury, they're going to feel frequency urgency because this is a nerve that gets turned on. The pain nerve, the C fiber nerve, is actually pretty hard to turn on. And normally it takes some sort of traumatic event to turn that nerve on. So the good news, Lisa, is you really just are having the alpha afferent nerve is irritated, which is giving you that frequency urgency. So again, something like a coating, like the Cystoprotect, the Cystorenew, a rescue instill would put an extra barrier on top of the nerves that would prevent urine from irritating you more. Then the other thing we really have to think about is, why is your mucosal barrier not protecting your bladder as well as it should be? And the answer might, in fact, be menopause. I don't know, hon, I don't know how old you are, so I apologize if you're in your 20s. But generally, not generally, factually, this blue mucosal layer is actually estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus. When you're older, you have less estrogen, you have less mucus. And so you're going to get to the point where you're going to have areas which are not protected. Urine is getting in here, irritating those nerves, giving you that frequency urgency. So if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And so you have to be on top of your skin health. It would be important to have somebody look at your vulva. If your vulva is dry, then so is your urethra and so is your bladder. And that's when we might want to consider using an estrogen product, an estrogen cream, a plain, simple estradiol cream that you can get at a compounding pharmacy that would give your body the estrogen that it needs to produce mucus. Now, you guys, if you come over to the IC Network website, we have a whole section of freebies, things that you can print out, like our medical records kits, our fact sheets, things like that. But if you sign up for our newsletter, you can get our 40-page free flare management guide, which gives you hour-by-hour rescue plans. So if you go to the IC Network website, which is ic-network.com, and sign up for our newsletter, then you can get our free, there you go. You can get our free flare management guide. And I really hope that that helps you. Ryan says, men with IC, why do we get painful erections and discharge during flare-up? Well, number one, the discharge is a concern. You shouldn't be seeing a discharge when you're having a flare. That's interesting. That's a little unusual. And that tells me that you might be having something a little bit more than a flare. It tells me that you might have some inflammation, irritation, chronic infection in your prostate or your bladder that might be triggering that discharge. But the painful erection in a man is usually tight pelvic floor muscles. And so I will tell you that the vast majority of men that we work with, when we think about those 5 subtypes for IC, the vast majority of them are actually men with pelvic floor injuries. If your pelvic floor is tight, it's restricting blood flow, and erection is dependent on blood flow, right? And it's hard for anything to be normal down there if you've got tight muscles. So I would really want to know, number one, Ryan, if you've had any pelvic injuries, what triggered your symptoms? What do you think triggered your symptoms? And have you had a pelvic floor assessment? I would be really fascinated to hear what the health of your pelvic floor is. All right. All right. Hi, Sarah on YouTube. I see Survivor is on YouTube, and she says she was recently diagnosed after 2 years of chronic pain. Well, I don't know if you're a man or a woman. I can tell you right now, you are in absolutely the right place, my dear. Or if you're a guy, you're in the right place, whether you're a man or you're a woman, and you're absolutely not alone. So Ryan says he has Hunner's lesions. Okay, so hopefully your lesions have been treated. If they haven't been treated, they need to be treated big time. I mean, seriously, get them treated. Lesions are treated with fulguration or laser therapy, a steroid injection, or Lyris, although the Lyris device is currently not available right now. But Lyris is the first treatment in history that has healed Hunner's lesions. So Ryan, here's the reality: is you've got a painful wound in your bladder, and it's pulsing. Let's just say there's always going to be a constant level of pain because you got an open wound in your bladder, right? So what are your muscles doing? Your muscles are trying to protect you from that pain. That's called a guarding reflex. And so the odds are that your pelvic floor muscles have now gotten remarkably tight just to protect you from that pain. And it's probably those tight muscles that are making your erections uncomfortable. That would be my guess. And what I would do if I were you is you need to have a pelvic floor assessment. We need to understand what on earth is going on with your pelvic floor, if anything. Okay. And that kind of comes right back down to Heidi, which is Heidi, when we ask the question, when is your pain the worst, before you pee or after you're done peeing? For Heidi, it's after she's done peeing. When you have pain after urination, that tells us that it's not your bladder wall. And let me show you why. Let me see if I can find this. I have all these slides here, guys. So here, hold on a sec. Let me pull that one out. American Urology. Let's see. Where is it? Come to me. Oh, magic picture of the bladder. Ah! Ooh, the magic worked. All right. So here's a picture of a typical bladder, a typical IC subtype 2 bladder wall driven, right? So you can see the areas where the bladder is wounded. I mean, you can see the spots. So hello, wounds. Now, unfortunately, the test itself can cause a lot of these wounds also, but from the bottom up, as your bladder fills with urine, urine fills up, right? And where does that urine go? That urine goes into every single wound, which is why the fuller you get, the worse you feel. And then as soon as you pee, urine is off of the wounds and you feel better. Okay, so you don't have that, hon. Heidi, you do not have that. So what that tells me is that your bladder is actually probably better than you think it is. What that tells me is that your pain is probably with your pelvic floor muscles instead. So you two need to have a pelvic floor assessment. Let's get an idea of what's going on. And it would be very interesting to go back to your history. When did your symptoms start? The risk factors for pelvic floor dysfunction are a history of athletics, a history of falls, having a baby, having pelvic surgery, a rape or sexual abuse. But generally, you know, kind of we see it the more in child athletes or ice skaters who fall a lot, gymnasts who fall a lot, football players, paratroopers, Ironman athletes, anything that puts pressure on the pelvic floor can trigger those tight pelvic floor muscles. And so for you with your flare, you're going to be doing something different. You don't need to do any of the bladder coating stuff because you're not having a bladder wall symptom. You're going to be focusing instead on muscle relaxation. So for you, using that heating pad is essential. Taking a hot shower or bath twice a day is what Rob Moldwin suggested in the class he taught on IC to urologists earlier this year. For patients with pelvic floor dysfunction, we have to completely reinforce relaxation. You might find a muscle relaxant helpful, like a vaginal Valium suppository, or using a glass wand if you've got a tight trigger point, or using baclofen or Flexeril. Baclofen is a non-sedating muscle relaxant that you can take during the day when you're working. Flexeril, also known as cyclobenzaprine, has sedative effects, so you can't take that during the day and you can't drive with it. You would take it at night. When I'm having pelvic floor tension, and believe me, I have a hell of a lot of it right now because of that freaking hysterectomy I had last year, I go with that 1/4 of a Flexeril. I would never take a whole Flexeril. I would never take a half a Flexeril. It would be very hard to function the rest of the day. So I'm the same way. I take a 1/4 early and it relaxes it enough that I can sleep. I wake up in the morning feeling much better, yada, yada, yada. IC Survivor asked, does the diet work? Oh, hell yeah, it works. Seriously. Seriously, but it depends upon your subtype, hon. You don't know what your subtype is. We got 5 subtypes. We got Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, and central sensitization. And at some point in time in this, I'll probably go over that. I don't want to quite go over those right now. But if you've got a wound in your bladder or Hunner's lesions, or if you've got a menopause-induced dryness in your bladder, yeah, diet is everything. Because if you poured acid on a wound every day, what's going to happen to the wound? It'll never heal. It'll probably get worse. Betty on Facebook says she's trying to get off Elmeron, couldn't tolerate Desert Harvest Aloe. Has anyone had anybody with IBS issues had success with Cystitis Protect? Betty, I have IBS. In fact, that's probably what bothers me more now than my bladder by far. I just have cramping a couple of times a week. It'll just happen randomly, usually about an hour after I eat, even if I'm following the IC diet and the IBS diet. I take Cystitis Protect, but I was one of those people. So the normal manufacturer's recommended dose of Cystitis Protect is 4 a day, 2 in the morning, 2 in the evening. But we IC patients are so freakily sensitive, hello, that what I always tell patients to do is start with 1 capsule, make sure your body likes it. Do 1 a day for a week, make sure your body likes it, and then go up to 2 a day for a week and make sure your body likes it. And I will tell you, for me, when I tried to go to 2 a day, it gave me loose bowel. And so when I take Cystitis Protect, I take 1 a day. And I haven't taken it in about a year, to be quite honest. So less is more. Jackie asks, is there anything equivalent to Elmeron? Yes. You can do a rescue installation in the doctor's office with heparin and lidocaine. You can do an Elmeron lidocaine installation because there's much less systemic absorption as compared to taking it by mouth. And you probably know now about the risk of eye damage, retinal disease, taking Elmeron for the long term. But the substitutes, according to Robert Evans, who taught the class on IC at the American Urology Association, and I put his slide on our Facebook page last May. These are the mucosal barrier options: Cystitis Protect, Desert Harvest Aloe, and the one he didn't have on the list but is absolutely part of it is Cystitis Renew. He was using an old slide set when he taught that class. These are the products that have a bladder are believed to have a bladder coating effect. Deborah says, are there any IC support groups in Northern California? Hun, I'm the only support group leader in Northern California, and I don't have in-person meetings anymore because I run the IC network and I do so many here. Ryan says, men with IC with swelling testicles, painful erections and discharge. You know, Ryan, honestly, the other thing I think you have to do, you just have to do it, given the fact that you've got swelling and given the fact that you've got a discharge, is if I were you, I would do a next generation urine test because that's the other subset of men that we tend to see more are men with chronic infection in their prostate. You have to understand that typical urine testing does not identify the vast majority of bacteria in the bladder. It only identifies 1% out of the potential good bacteria and bad bacteria in the bladder, as well as, and it doesn't even identify fungi. What most doctors are using now for complex patients where we have a suspicion of UTI, we have a suspicion of an infection, but your urinalysis is coming back empty or coming back negative, the next step is this, because this will determine once and for all if you've got chronic UTI or chronic prostate infection. Next generation urine testing, they don't grow it out in an agar plate. What they do instead is they send you a kit, you pee into a bottle for 3 times over 12 hours. And then you end up sucking up, maybe this much, a little tiny bit of it, and you send it to them. And what it does is they will pull any DNA fragment they find in your urine, and they will give you a profile of good bacteria and bad bacteria, and even more importantly, fungus. Because we now know from the National Institutes of Health IC research effort, which is called MAP, the Multidisciplinary Approach for the Study of Pelvic Pain, The MAP network combines IC research with chronic prostate and prostatitis research. And they were the ones who discovered that many patients having flares actually have an overgrowth of yeast in their bladder, probably from too many antibiotics. Even if you haven't taken antibiotics in a year, that environment has been set. And of course, a typical urine test will not identify candida. However, next generation will. And the cool thing now is this test is only $199, where before, even a year ago, it was thousands of dollars. And this is really what all the major IC and urology and even sinus, this is where it's at now, is next generation. You're going to find the words next generation DNA in many, many future IC studies that we highlight, because this is teaching us a hell of a lot more about what's in the bladder than the old urinalysis that was invented 100 years ago or 90 years ago, whatever. All right, so bladderhealth.org, guys, go over there. I've got a whole bunch of videos on there of urologists talking about how they use this. I had this done myself. It's fascinating. And if you're one of those people where you just really think that you've got UTI, even though your tests come back negative, you can now prove it. You know, one of the things that's cool here is that there are giant databases now stored by the National Institutes of Health, I think, and also the Center for Disease Control. And so they are now able to track the DNA, and they can track antibiotic resistance. I mean, the data you get from this test is incredibly powerful. And I would do it. I just think I think that almost every patient at some point in time should do it once, just out of curiosity, just to see what's in your urine. Alrighty then. Barbara asks, how am I? You know what, guys? I'm pretty good. I feel pretty good today. I'm really happy that we don't have smoke anymore and that we've had some really, really big rainstorms. So the fire risk in California is now slim to none. Praise God, hallelujah. It was a hell of a year for us. We can go outside and breathe, and that's a really, really good thing. Physically, my bladder's pretty good, but my pelvic floor is really a trial doing physical therapy. And again, I was good until, you know, the surgery last year. The surgery last year really set me back big time. And I think for me, the curious thing for me is my IBS right now. My dad and I both are just having, like, every other day, we'll have like an hour of irritants. And I'm not quite sure why. I'm trying to figure that out. It might be stress related, but it could be food related. I will tell you that because I'm caring for a 96-year-old and a 90-year-old, I do HelloFresh to make their meals. And I normally wouldn't do something like that because I like to know where my meat comes from. But it's really helpful to have, you know, these meals that I can fix. So I kind of have to wonder if the food isn't quite as organic as we want it to be. But other than that, thank you so much for asking. Thank you so much for asking. All right, let's go back to your questions. So Heidi's pain at the end of urination happened after they removed kidney stones. Okay, and she's a nurse. She's working in the ICU and does not have access to a restroom. Now, Heidi, I'll tell you, we did a really interesting employment profession survey of IC patients quite a while ago, but we had, I don't know, like 1,000 patients participate. And we asked them, what is your career? What do you do? And you would be very surprised to learn that the top 2 professions that we associated with IC were teaching, where restroom access is very limited, and nursing. And the fact that you do not have access to a restroom. The other thing, I worked with a nurse last year or 2 years ago who confessed to me that all the nurses drank Crystal Light during their shift. They didn't drink water. And that had been going on for 2 decades. And she firmly believed that played a massive role in the irritation of her bladder with all that artificial sugar. Okay, so Lisa, getting back to Lisa with her flare, she's been on Cystitis for 2 months, does her harvest allergy for 3 weeks. Now when her bladder fills, instead of burning, she feels pressure. The pressure is not cool, but more tolerable than the burning. So that's good, hon. It means that it means that good things are happening. I kind of associate pressure more with the pelvic floor, though. She asked, could this be a step towards healing? Definitely. You know, guys, let me just say one thing. Whenever you try treatment, it's really important that you do avoiding diary the first day, right? So we know where your baseline is. If you could take a day or two before that treatment or before you go to the doctor's office, take 2 days and do avoiding diary. Write down the time that you pee, the quantity that you pee. You don't have to measure it, just a quarter cup, half cup, squirt, teaspoon, whatever. And rate your pain on a scale of 1 to 10. Okay, do that for 2 days and save a copy of it, give it to your doctor to go into your medical record, because that's really good evidence for Social Security if you ever have to apply for disability. But even more so, what that is that's the data that's going to help you figure out if a treatment is helping you. Because, so like for me, the summer of 1993 was my nadir. It was the worst few months of my life. It was the time where there was no hope, and I was thinking really, really dark thoughts, right? And I was sent to UC San Francisco, walked into the doctor's office. He took one look at me and he goes, "You're in agony right now, aren't you?" And I just burst into tears and was like, "Yes." And his name was Dr. Marshall Stoller. And Dr. Marshall Stoller is the guy who invented ankle stem urgent PC, right? And he said, "I think I have something that's going to help you." This was literally the first year that it was developed. I became one of the very first patients who did what we call post-tibial nerve stimulation. And it's done at the ankle. And let me see if I can show you my tattoo. Let's see. I don't know if you can see, there's a little black spot there. I have that spot on both legs, and you'll see here. So look at this. So here's your ankle bone, right? It's 3 fingers up. So here's my spot. It's basically 3 fingers up from the tip of the ankle bone, and it's basically 2 fingers down. And that's called SP6. That's an acupuncture point. And so what he did is they were operating from the assumption that part of the pain for some people is nerve dysfunction. So if we can re-regulate that nerve with a little electrical impulse, maybe we can turn some of that pain off. So you do it. For anybody who's done it, it's the first thing you do before InterStim, because it's not invasive. It's just an acupuncture needle right there attached to a TENS unit. So I'm doing my voiding diary, and I still have that voiding diary in my shelf here because it was a seminal moment in my life. At week 1, no change. At week 2, no change. At week 3, 2 hours without pain. Stunning. I had been in pain every day for almost a year. I had my first 2 hours without pain. And my frequency was going, instead of peeing 30 times a day, I was going, 25 times or 18 times. But even though I was in agony at other times, I could not deny the data that I was looking at in my voiding diary. I was peeing less. Something good was happening. So I kept going down to UCSF. It was a 70-mile drive for me. No piece of cake, let me tell you. At week 7, I had my first 24 hours without pain. Stunning. And again, if I hadn't had that voiding diary, I wouldn't have seen it. Because one of the other things that happens is you forget your good days when you have a bad day. So you might have had 3 really good days this week, but today is a crappy day and you're in agony. And you know what? You forget all the good days. You forget them. But when you've got it literally in front of you, you can look at that and take hope from that and comfort from that. It's like, oh my God, something is changing. Something is better. Yeah, I still hurt sometimes, but I can see it. I can track it. And Lisa, you asked, could this be a step towards healing? If you were doing a voiding diary, I'm sure that that's exactly what you would see. Kay asked, any advice if you have all 3, IBS, IC, and pelvic floor spasms in a flare since November 2nd, any help? Well, number 1, we've got to get these spasms under control, my dear. So the question is, are you having a striated muscle spasm from your pelvic floor, or are you having a smooth muscle spasm from your bladder wall? They're very different. If you're having, so bladder spasms usually occur as the last couple of drops of urine are coming out. So you're sitting there peeing and reading your book, right? And then all of a sudden you just go, you know, you just like, oh my God, what the hell is that? Right? And it kind of shoots up your back and down your legs. It's just, it's very, very consuming when you have a bladder spasm. Bladder spasms, again, come from smooth muscle. Therefore, you have to have a smooth muscle relaxant, and that is usually oxybutynin ditropan. If you're instead having a pelvic floor spasm, then you're going to need to use a striated muscle relaxant, which is going to be vaginal Valium, Flexeril, Baclofen. So I think the first thing we've got to do is we got to get these spasms under control. And then you have to really try to think about what could you be doing that could be provoking those spasms. Bladder spasms for me are either one of 2 things. Number 1, you've got a UTI that you just have missed. And that's when I had them, is I thought it was a flare for 6 weeks. And it turned out it was a wicked UTI. I had no idea until I started having these spasms and went to my urologist crying, walked in the door crying, and they'd never seen me cry before because I was their support group leader. And I explained the bladder spasm, and she goes, girl, you have an infection. And a culture proved that. Or your bladder wall is profoundly pissed off that there is something going on daily in your life which is provoking your bladder. And it's typically, which is going to be ironic given what I'm going to talk about today, it's going to be coffee. If you're drinking a cup of coffee or a Coke or a green tea is agony. If you're taking a vitamin, if you're drinking a water out of a Brita water filter, if there's something in your daily life which is really provoking your bladder wall. Now, your pelvic floor is different. With your pelvic floor spasms, it's either your muscles are weak, they might be injured, they might be overcompensating for pain. I would want to have a pelvic floor assessment, and I would want to see what's going on with your pelvic floor. So at this point in time, you don't have the facts yet, and we need the facts. And the way you get the facts is you work with an expert. So if I were you, I would absolutely come to our website, go into our database, find a physical therapist, and go have a pelvic floor assessment. See if we can figure out what the health of your pelvic floor is. Okay. Karen asked, what does the aloe vera do? Do you have IBS-C? I have the IBS that rotates between diarrhea and constipation, and it just gave me loose bowel. Amy says that when she was first diagnosed, she came to IC support groups, which scared her because everybody was so much worse than I was, and it gave you anxiety. Yeah, that's the problem with support groups. Any support group is it's always biased towards people who are suffering. So we have this in our own support forum, which is the oldest support group online. I mean, we've had that support. We got more than 50,000 members of our support group on our website. And we've known from day one that that was an issue. And so, you know, you have to have that balance. And if you're feeling anxious and depressed, please, God, do not come and don't come and read IC stuff all day. Don't do that. We need to distract your brain with something else. I would rather you get outside, take a walk in the sunshine, go laugh a little, go do a little exercise, make some cookies, read a book, do some work, whatever. But what I don't want you to do is to just keep reading sad story after sad story. One of the problems that we have with Facebook and any online group, including our group, is you can read somebody's terrible story and think it's going to happen to you, but it's not, because we have subtypes. Now we have the subtypes. And so if we could go back and if we could qualify every post with their subtype, then it would make more sense. So if you, my friend, have central sensitization, you're never going to have to worry about IC subtype 1 Hunner's lesions. Just like if you have Hunner's lesions, you're not going to have to worry about pudendal neuralgia and so forth. And so, you know, you cannot assume that what happens to somebody else is going to happen to you based simply on the subtyping system. And that is why that is so important. Raina asked, does ICN lead to cancer? No, it does not. However, what I will tell you, I'll give you two factoids on this. Number one, when I was in the summer of 1993, when I was being diagnosed and I was in agony, I was completely convinced that I was dying of cancer. Even if I had a urine cytology, which is a test which looks for signs of cancer, which was negative, I didn't believe it. I did not believe it. And I went to my OBGYN and I went to my urologist and I said, I'm sorry, I don't believe this diagnosis. I think I'm dying of cancer. I want you to open me up and look. I want exploratory surgery. And, you know, they did it. They did it. They did it for me. And I woke up in the recovery room and they said, you're fine. You don't have cancer, hon. You've got IC. You're fine. I mean, from the cancer standpoint. However, I had worked myself up for months thinking I was dying of cancer, just months and months and months of catastrophizing and thinking about it. And what I can tell you is there's not a single connection between IC and cancer that has ever been published. What we have seen is some people have been mistakenly diagnosed with IC when in fact they could have had cancer because a doctor was guessing, right? So, you know, I'm all about the facts. I want the facts. I want hard data. I don't want anybody, if I'm in agony and I got blood in my urine and I go to the doctor, I don't want them to guess. I want them to test. I want them to test. I want them to tell me what this could be. And so in those cases, usually what has happened is that really basic cancer screen, that urine cytology test that's normally done as a diagnostic workup was not done in a timely way. So if you were a smoker, then, and you've got frequency urgency, it is in your best interest to have a urine cytology test. You just pee into a cup, they send it in a lab. The vast majority of you have already had it done. They just didn't tell you they did it. Just to be on the safe side, just to make sure that you might not have picked up that. The other thing that I think is important to note is HPV, human papillomavirus. We know that the HPV virus has been proven to be linked to cervical cancer and rectal cancer and urethral cancer. And I was working with a 36-year-old couple months ago who had urethral cancer from HPV, and they did bladder removal, urethra removal, and a full hysterectomy because of HPV. So if you have ever been HPV positive, then pay attention to any change in your symptoms. But out of the, I think that there are 20 variants of HPV, only 2 are associated with cancer. The vast majority are not, and patients usually, their bodies defeat the virus and life goes on. But if you're unlucky to get, I think it's variant 16 and something, there are 2 different variants. Those are the ones where you got to pay attention and just be proactive. Okay. But I want to ease your worries. But if you are worried, just go to the doctor, ask for a urine cytology test. That will answer it once and for all. But don't do what I did and catastrophize for months and months and months like I did. Betty said when she tried aloe, she got gassy and bloated when she switched from 1 to 2 capsules a day. You know, guys, that doesn't surprise me at all because we all have individual tolerance levels. And for some of us, we just stay at very, very low doses and we don't titrate up. Sharon says she has Hunner's lesions and was told she has a lot of scar tissue. Does that make sense? Sure, sure. Because a lesion is a big wound, and when that lesion is cauterized, it will have scar tissue. Scar tissue can often also happen after infections. So the bladder, like any other part of the body, when it's injured, it will try to heal that wound, but it can leave scars behind. The challenge with scar tissues in the bladder is it makes it hard for the bladder to, your bladder is like a sack, so it's pretty small, right? Pretty small when it's empty. And as it gets it fuller and fuller, it stretches and stretches. And that's the miracle of the bladder. It's a fascinating organ biologically, how it works and how those cells stretch and contract and stretch and contract. But when you have scar tissue, that won't stretch as much. And so your capacity might reduce, will reduce. Maribel is asking about a paraurethral gland infection. So she has another UTI after bladder installation. I mentioned the other day about urethral pain and that it might be an infection that the doctor can drain. Can you explain that again? Okay, so that is within the context of urethral pain. So and parts of it applies to men and women, but parts of it apply to a woman only in certain ways. So the urethra, again, like any other part of your body, can speak. It can hurt. In fact, mine gave me a little zing the other night, which told me I hadn't used my estrogen. I went and used my estrogen. All right, my estrogen cream. So what is going to trigger urethral irritation? Number 1, bladder infection. When you've got a bladder infection, that infection tends to not only fill the bladder, but it starts to also affect the urethra. And one of the symptoms of bladder infection is burning while you're peeing, okay? But the urethra can also be sensitive to chemicals. So if I put on a pair of underwear washed in sheer or tide, within 5 minutes, I will have urethral burning. My body, my urethra down there does not like any irritating chemicals. I even have issues, or I used to have issues with menstrual pads, with some menstrual pads that would release some sort of gas that would irritate those. Menopause can play a huge role because your urethra, like your bladder, relies on mucus, right? And so this not only applies to the bladder, this applies to the urethra. But the urethra is going to be often one of the first part of the urinary tract to tell you that you're a little estrogen deprived. And it will give you the sensation that you've got a drop of urine stuck in your urethra that will not come out despite how much you strain. And that's really how the urethra tells you that it's irritated and wounded. But the other thing that's interesting about the urethra is that it is directly affected by the prostate. And for men, we know that the prostate is at the base of the penis. Well, we women have a prostate too. We really do. It's called the paraurethral gland. And so your urethra is about the size of your little finger. And so about halfway up your urethra, on the outside of your urethra, is a sponge-like gland called the periurethral gland. And in fact, the very first article I ever put on the IC Network when I built our website in 1994 was an article on the periurethral gland from UCLA. And they argued very, very correctly that the tissue of the female prostate and the male prostate are identical. They're identical. And like the male prostate, the female prostate has very tiny drainage ducts. You know, I mean, it's just really fair to say that humanity does not understand the role of many structures in our body, like our appendix. And the function of the prostate gland in a woman is interesting because we don't necessarily know what it's supposed to do. But we do know is that it drains tiny, tiny ducts. And those drains can be blocked. Just like the male prostate, the female prostate can become stagnant and become basically the equivalent of a pimple. And I've worked with many patients who have had these over the years. And so the way you can tell if you have an infection of your periurethral gland is you wash your hands really, really well, obviously for one. You, use a little KY, put your finger about an inch up into your vagina and rub across the front of your vagina because your urethra is in front of your vagina, right? So you're just going to rub there and see if you feel any little painful lumps. It's basically the size of a pea, but it's like a deep pimple. You know, you ever have those pimples that are sitting on a nerve? And you push and push, and there's no whitehead, and you can't drain it out, and it's irritating. That's exactly what this gland feels like when it's infected. And so generally what a doctor will do if they feel that you have this infection is they'll put their finger in your vagina, and they'll put a little sound, a little metal instrument in your urethra, and then they squeeze it. And they try to express the fluid. And when a man has a prostate massage in the rectum, that's also what they're doing. They're squeezing that prostate to get fluid out. For a woman, it's much trickier. So you got to have two things in there. And what's so interesting about that is when they culture out that pus, it's not one bacteria. We call it a heterogeneous population. It's not a homogeneous population. It's heterogeneous. It means that there are many different types of bacteria living in biofilms in there. It's fascinating, absolutely fascinating. So Maribel, that's how you would check. If you touch the front wall of your vagina and you don't feel any painful spot, any painful little lumps, then you don't have it, and you can let that go. Melissa is laying there with a heating pad on your girl. I slept with a heating pad for 5 years. Sherry uses Calciblend instead of Preleaf. You know, Karen, I had eaten. I'm just a redhead. And I'm very, very drug sensitive. I see subtype 5. Ravonda says, her doctor used ketamine when inserting a chest tube in the emergency room. Learned on the IC Network that ketamine can be a bladder irritant. What about when it is used for lidocaine amitriptyline cream for vulva? You know, ketamine is a really interesting story because ketamine is basically an anesthesia used by vets, by veterinary doctors. And it was about 25 years ago that people learned that when they used ketamine, they got what we call a dissociative high. Ketamine does not cause addiction, but you feel like you're floating. And so very quickly, ketamine became a drug on the street. And in fact, I run the Ketamine Cystitis Network as I work with ketamine addicts. One of the first patients I was working with was a Hollywood producer who, in his group of friends, they would drive down to LA, go to a vet supply center, buy ketamine, bring it back, and get stoned every day. And when you start using it every day in high quantities, what happens is it's basically a solvent in the bladder. And so in his case, he knew after several months of using it every day that it was affecting his bladder because he would pee. He was peeing blood. And he'd be like literally standing there peeing blood, and he knew it was ketamine, but he couldn't stop it. And he actually ended up going into one of the Dr. Drew rehab centers to help him get off of the ketamine. But that's how we learned that ketamine can damage, if not destroy, the bladder, was through 20 years ago, 15 years ago, these addicts who were using it in very, very high quantities. Now, ketamine does have a place in human pain care. Ketamine has been used for end-of-life care for a long time, and we certainly have no problems with that at all. But if you're younger and you're using ketamine, you have to listen to your body. If you're starting to feel any bladder irritation, you're using too much. So you're going to have to, so using the ketamine cream with lidocaine on the vulva, that's solid as long as you're not having bladder symptoms. But the minute you start having bladder symptoms, you've got to take a step back for a moment, look at the dosage. Maybe they can back off on the ketamine, increase the lidocaine instead to reduce some of that bladder wall irritation. Krista says she has an amazing pain management doctor, and she gets ganglion nerve blocks. You know, Krista, I would really absolutely love for you to tell your story, and I'd love to do a story on those for other IC patients so that they can learn about that. If you could reach out to me, send me an email. I'd love to talk to you further about it so that we can tell people that that also is an option. Sherry, we have an hour-by-hour rescue plan in our flare management guide. All right, Kelly asks. Kelly has asked the magic question, because this is what I wanted to. The little educational thing that I wanted to do today is I wanted to talk about hot drinks, and you know, kind of address that question of, can you drink coffee? Can you drink stuff when you've got IC? And the answer is sometimes maybe you can. We have what we call the coffee challenge. So, okay, let's see. I want to say this the right way. If you've got active symptoms, or if you have Hunner's lesions, I do not want you drinking coffee, period. Because again, it's about wound care. If you are IC subtype 1, IC subtype 2, we're dealing with direct bladder wall injury, trauma, wounds. Okay. So in that case, we have to protect those wounds. So I do not believe any Hunner's lesion patient should ever drink coffee until those Hunner's lesions are treated and have healed. If you're IC subtype 2, bladder wall driven, that means that you've got bladder wall injury. If your bladder is healed and you are not symptomatic, can you have coffee? Maybe. And I'll go over that in a minute. If you're IC subtype 3, pelvic floor dysfunction, that means your bladder is pretty healthy. It's your muscles that are driving your issues. You're probably going to be able to get away with coffee. Same with IC subtype 4, pudendal neuralgia. IC subtype 5, central sensitization is another story, because for those of us with central sensitization, myself included, we have a very sensitive nervous system. And so when I drink coffee, if I'm exposed to any caffeine, which is neurostimulatory, it messes all my nerves up. And I will shake like a leaf, and I will not sleep for 36 hours if I drink caffeinated coffee. Okay, so number one, it's based on your subtype. IC subtype 1, no. IC subtype 2, maybe. IC subtype 3, 4, yeah, probably. IC subtype 5, only decaf. Only decaf. Okay, now that said, the proof is in the pudding here. The proof is in the test. So I call it the coffee challenge. So the first thing we have, okay, if you're in a flare, the only thing I want you drinking is hot water or chamomile herbal tea, right? That's the only thing you should be drinking. We need to get you out of this flare. So for whether it's a week or two, or a month or 2 months or 6 months, we got to protect the bladder, right? If you're starting to feel better and your voiding diary shows you're peeing less, you could then try a brown rooibos tea. And hold on, let me get it. I don't have it here. Hold on. All right. Hold on. Let me shut that door. Okay. Rooibos is a brown herb that's very, very mild. Okay. So this is the one, it's called herbal red bush. So this would be the first thing I would want you to try in a small amount and see how your bladder does. I only drank water and chamomile tea for probably 18 months when I was at my worst. Okay. And I can drink almost anything now. Okay. So rooibos is your next step. Do a week cup. And see how you feel. You put milk in it, you put sugar in it, whatever. As 1 cup, make it fairly weak, see how you do. If your body likes that, of course, then the next one you can try a little bit stronger. See how you do. I can drink this tea every day and it doesn't bother me. I've been drinking this tea for a couple of years now. I used to love chai tea and I don't do any caffeine now. Okay, so we've done the chamomile. Now we've gotten the next step, and we've gotten to a brown rooibos tea. And again, it's brown, right? I mean, it's brown. So it looks like coffee. It's as close. This is as close to like a pumpkin spice latte that I think you're going to get. That's not real coffee. Okay. If you do okay with this, the next thing you're going to try is an herbal coffee. And that is what Kelly just asked on Facebook is, what about Ticino with no acid or caffeine? There are several herbal coffees. There's Ticino, there's Caffrey Roma, and there's Pero. And I'm sorry, we used to sell those for years in our store, but we changed grocery suppliers, and so we don't have those anymore. But Caffrey Roma, Pero, or Ticino. That would be the next step. Let's see how you tolerate those. Kelly, I personally found Ticino very bitter. I did not like it at all. I did better with the Pero when I was doing the herbal coffees. So you're going to do herbal coffees for a week or two and see if your body likes that. If your body likes the herbal coffees, then you can try a real coffee, but I need you to first try a low acid decaf coffee like Tyler's. So this is Tyler's. Now, he calls it an acid-free coffee. It is not acid-free. Everything in testing, acid-free would be pH 7. This is a little bit less than pH 7. And he and I have had discussions about this. Tyler's a great guy. This is a pretty good product. So you could try a decaf low acid. Tyler's is an option. However, and he makes a it's a K cup. They also have K cups. But the one that I think you should, that is absolutely worth trying also, if not more so, as you experiment with your coffees, is Bella Rosa. And this package got all messed up when I unpacked it. What makes Bella Rosa coffee so interesting is it is the low. Okay, hold on. I got to get the name of the acid, and it's right on the tip of my tongue. So Bella Rosa coffee was invented here in Northern California, and I had never heard of it until like 5 years ago when a new employee of the IC network told me about it. And she said, "Hey, do you know about Bella Rosa coffee? It's the only coffee I can drink that doesn't irritate my stomach." And I was like, and she said, I can drink it as much as I want, and it doesn't hurt me at all. And that got my attention. So then I went over to their website and I looked at it, and what happened with Bella Rosa is they created their own custom engineered roasting process.